Hi guys, welcome back to my channel, Sunshine Acupuncture. I want to let you guys know if you have questions regarding acupuncture or topics related to health, you can leave them in the comment box below and I will try to either respond to them or maybe respond back through a future video. So just to let you know that you guys can ask me questions regarding acupuncture. So today I'm going to do my topic on acupuncture and arthritis. Arthritis is also a very common condition among elder patients, and it gets worse around this time of the year during the winter. So I'm going to talk a little bit about that and how acupuncture can help. So let's get started. As I was saying, there's two types of arthritis: rheumatoid arthritis and osteoarthritis. Osteoarthritis is the one that's more common in majority of the population, especially in the elder population. It's just a degeneration of the actual joint, may it be hip joint, knee joint, shoulder joint, or even in the spine. So any places there are joints, arthritis can be formed. Basically, arthritis is when the bone more or less in the joint kind of degenerates, and then moving in that joint gets more difficult because the bone degenerates and the fluid in that joint socket gets less, so you kind of, and the cartilage also degenerates. So what happens is you are having less cushion in between the joints, so your bones are kind of frictioning against each other is the way to look at it. And this is very common in especially knee joints, that when you have arthritis in the knee, that when you try to exercise, it actually hurts, because when you're walking or going up the stairs or whatever it may be, that it hurts your knees because your knees are actually the joint like has less cushion, like I said, and then the bones are degenerating, so that there's friction among the joints, so it causes you to have more pain. Now with that said, that's not the only time that pain can occur. You can have pain when you are not moving. When you're just laying around, you might feel some sort of achiness, soreness in your joints as well. It is, in Chinese medicine we call it a damp condition, so it's affected by the weather, especially osteoarthritis. So when it's raining out, when it's damp outside, that you will feel more pain in your joints, because it's a damp condition in Chinese medicine. So, and with that sort of a condition being a damp, not moving is actually not good, because you're getting more damp accumulated. So when you don't exercise, it's actually not good for your arthritis. It's actually good to exercise, but then again, it's hard to walk. For example, when you have arthritis in your knees, or when you do walk, it hurts more. So it's kind of hard, because you have a no-win situation in any case. If you don't exercise, it's bad. If you exercise, it hurts. So what I would recommend is swimming is a good exercise, because when you're in the water, your body weight is much less. So, and swimming is also a good exercise in itself, but the fact that you are lighter in the water makes it less pressure on your joints, like for example your knee, because when you're walking, your knee is carrying a lot of your body weight, and that when you have an issue like an arthritis already in your knee, bearing the weight and then walking is not good. But when you're in water, you're much lighter, so when you swim, it's actually it doesn't affect your knee per se, and you're getting a good amount of exercise for your body, and you might see improvement in your joints or in your mobility or in your arthritis overall. So I highly recommend swimming. And so and I also definitely recommend exercising in general. Like if you can, if walking is not an issue, you should walk. Like you should stay active. That is a good way to kind of keep your arthritis at bay. And on top of this, of course, I recommend acupuncture, because when you get acupuncture, you will be able to control your pain level. Like you can get your pain down to a point where you're comfortable, it's not bothering you, so then you can continue to do your exercises and other things that you need to do in order to keep your arthritis at bay. And sometimes patients complain to me that they are having issues sleeping at night, or the pain is keeping them up at night and things like that, so they're not getting good rest. That's why exercise is important, again, to kind of what I'm trying to say is that, like, if you go to acupuncture and you get treated for your arthritis, you will be able to get to a point where your pain is manageable, or even no pain, because what I see in patients is they'll have absolutely no pain for a day, like the day of the treatment, or maybe the following day, so that they are able to do more kind of exercise or activities. And then at the same time, being active will help you sleep and everything at night. And also when you're having minimal pain or no pain and you're active, it also kind of helps your arthritis, so that you will have no pain or minimum pain at night, so it helps you sleep, so you're getting into like a good kind of habit and good cycle and everything like that. So yes, acupuncture is extremely effective for arthritis, especially osteoarthritis. Now, rheumatoid arthritis is a little bit different in that the nature of the disease is a little bit different, in the sense that you will have times or flare-ups where you are unable to get out of bed because you're in so much pain, or you might have like maybe headaches, or like there's more symptoms to it. It's a little bit different than osteo. There's more to rheumatoid, and osteo is more just the physical component. There is nothing else to it. It's just that, like, the knee is being degenerative, or the hip is being degenerative. And what I see a lot of times is that with this kind of condition, it gets to a point, the degeneration gets to a point where the hip or the knee needs to be replaced, and that's what the doctor recommends, and that's what the patient gets. They get a knee replacement or hip replacement. Now, these are major surgeries. You will take a long time to recover from that. And at the same time, sometimes, it's good, sometimes it's bad. It's hard to say. I mean, I've seen patients who got their knee replaced and it's fine. And then I've got people who got knee replaced and it's still bothering them and they still have aches. So it's, it's hard. It's a risk you need to take. So if you can get your pain managed with acupuncture, that you don't have to get a knee or a hip replacement, I would definitely encourage that, because surgery in general, it's a risk involved. So you don't want to go into unless you really have to. And I think arthritis, especially osteoarthritis, is a condition that can be managed if you go for once a week to get an acupuncture treatment and you stay active, and go to the gym or do some sort of exercise for a day or 2 days out of the week. So, with that being said, you should be able to manage your pain. I mean, I have great results with patients that have arthritis for a long time, and they come and then basically within 3 treatments, they telling me they have no pain for 3 days, and it comes back, but they've had pain every single day for years, and and then the first time they got treated, they had no pain that day, but the pain returned the next day, and the second time it lasted 2 days, and the third time it lasted 3 days. So, and that's just having 3 treatments. I mean, if they continue to see me after a month or 2 months, they may be able to last 4 or 5 days without any pain. So, being active is a must to get your arthritis at bay, because you want to keep active. That's how you build your bone mass and muscle mass and etc. So, if you're basically bone shrinking, you want to keep active to keep your bone shrinking as little as, like, it shrinks as little as possible. And also, with the help of acupuncture, you are able to keep yourself active, basically, is what I'm trying to say. So yes, please get acupuncture, and please, stay active, swim, do exercises that are not, that you can do, and swimming is an excellent one. So, and also warm climate helps. So if you have the luxury to move to somewhere warm in the winter, like go to Florida or something like that, it will also help your condition, because it's much warmer there and less cold and damp. Like I said, arthritis is a condition that's caused by damp and cold, and when you have, not caused by, but it's affected by damp and cold. So when you have damp and cold conditions, it makes your arthritis so much worse. Like, it just, you feel it when it's raining and cold out. Your knee gets worse and stuff like that. I hear that all the time from my patients, saying that they can feel it's gonna rain tomorrow from their knee and stuff. So those are my tips and advice on how to keep your arthritis at bay. And acupuncture is wonderful to help with that condition. And this pretty much wraps up my talk for the day. Like I said, if you have questions, you can leave them down below in the comment section, and maybe I'll do a video in the future regarding your topic that you want me to discuss. And besides that, just have a great day and stay healthy and be well, my friends, and I'll see you guys next time. Bye.